When treating the hamstrings, it's a good idea to, of course, do your range of motion testing to see if the hamstrings may be overstretched, because if they're overstretched, it can destabilize the pelvis and cause back pain. So if that's the case, they'd want to do more strengthening in the quadriceps, then you would want to do a lot of muscle belly work. So in this case, if he had a hamstring strain where he could point to a specific area that he felt was strained or uncomfortable, we want to warm it up first and then go into our steps of realigning the strained tissue. So the way we warm up the hamstrings is I take my heel of my hand or my forearm and I just internally and externally rotate his hip as I pin the hamstrings down, and then as his leg moves lateral, I move medial. And we start at the lateral around the IT band, stripping right over the hamstrings from lateral to medial. Wherever you feel like something's stuck, you just stop. You can feel where that fibrosis is. You could hook into it, move the leg towards you, and the tissue underneath your elbow away from you or medial. That will help separate those hamstrings, reduce the tightness in the hamstrings. But if they were, let's say, if they were hypermobile and had too much flexibility in the hamstrings, you would want to do more of your quick compression movements to activate those muscle spindles, and they'd want to be doing more toning of the hamstrings as their post-treatment or home care. If they had a specific area of strain, for example, a common area is right at the attachment to the hamstrings underneath the sit bone. So if they were able to point to that area and you were able to do a manual muscle test, go ahead and lift your leg up, that reproduced the pain, you go right to wherever they feel the discomfort, they point to it for you, and you apply your multi-directional friction. You want to retrain that muscle. So I'm just going to put 2 fingers of tension or resistance as he raises his leg up. Just resist for several seconds and relax. We can't get a really good hamstring stretch here, but we'll just bring him off the table best we can. Stretch that muscle out, and then always retest. Pick up the knee, push up into my hand, and relax. If there's still discomfort there, repeat those steps again. Only repeat them a couple times. If the hamstring is still, if there's still indication that there's hamstring strain, move on to the popliteus and plantaris, or the milking of the popliteus and plantaris, because a lot of times that will reduce tension in this whole group of hamstrings. So 2 or 3 times is all we'll do one technique till we move on to the next muscle, and then we go back to reassess. So here is a very vulnerable area. We've learned in school not to press in there. So we just place our thumb very, very gently right in the crease of the knee, and then bring the knee up into flexion, and then slowly bring the knee down. As I bring the knee down, I want you to focus right in on my thumb and see how it just gently glides up the back of the leg. Not very far, just an inch or so, but you're not moving your thumb. It's not your power that's moving the thumb. It's just the skin being pulled taut as you extend their knee. You can do that several times. I believe this is also a technique taught in most lymphatic workshops, so it's really good to stimulate lymphatic flow as well. And knees have about the least amount of circulation of any joint in our body, so the more we can get in there and increase circulation lymphatically, the better.